everyone. Today we will start new chapter, that is drug dispensing and distribution system. Today in this video we will cover first topic, that is the dispensing of drug to inpatient in the subject pharmacy practice. So first we will start with the dispensing of drug to inpatient. So here first we need to consider what is drug distribution. So drug distribution, that is, we can say the physical transfer of drugs from storage area in the hospital to the patient's bedside or to outpatient. That means we are transferring here drug. Generally in a hospital, if you are considering, then in a hospital the drug that is stored in a pharmacy store, so we are transferring from the pharmacy store, that means the drug store, to the inpatient bedside, or if there is a OPD, that means outpatient, then we are transferring this drug to the outpatient. So the overall drug distribution and utilization process in the hospital, it will involve an infinite number of procedure, personnel, departments, equipments and storage facility. That means so many things that is required if you want to transfer or if you want to distribute our drug from the drugstore to the patient. So this is the common thing we need to understand about the drug distribution in a hospital. So if we are considering the drug distribution in India, then we need to understand we are distributing the drug in an ancient time or in a past time. Extemporaneous prescription was there in the ancient time, or previously there was a system in which we were preparing the mixture, emulsion, ointment, paste and suppositories, and in this kind of preparation or this kind of prescription, that means extemporaneous prescription, where the pestle, glass, mortar pestle, glass measures, then glass rod and spatulas, these all the machines and suppository molds that was required. So in such kind of preparation, it requires the scientific knowledge and techniques, and also it requires the skill and art to prepare the product. But nowadays in India there is a ready-made product, that means directly ready-made liquid products, or if we consider the ointment or paste, or directly the tablets that is ready-made, that is available directly to the drugstore. So now there is no need of preparation at the time of when we are transferring our product to the patient. So now the days have been changed, and nowadays the drug that is distributed in a hospital by the indent system. That means one of the written requisition slip from the wards that will come to the pharmacist, and on the basis of that we are transferring our product. That means on the basis of that we are transferring our product to the nursing station or directly to the patient. In case of outpatient, there will be the indent like this. This is known as a requisition slip, and by the basis of this directly we are transferring our product, or directly we are distributing our product with the help of this. तो यहाँ पे क्या है कि अभी सिस्टम पूरा चेंज हो गया है. पहले डायरेक्टली हम प्रोडक्ट प्रिपेयर करते थे एट द टाइम ऑफ डिस्पेंसिंग, और नाउडेज प्रोडक्ट प्रिपेयर करने की कोई जरूरत नहीं है, डायरेक्टली रेडीमेड प्रोडक्ट अवेलेबल है. एक इंडियन सिस्टम होता है हर हॉस्पिटल में, तो मतलब रिक्विजिशन स्लिप आएगी और उसको हम बोल सकते हैं प्रिस्क्रिप्शन डायरेक्टली दैट विल गोज टू द फार्मासिस्ट एंड he will directly deliver the product to the patient. Inpatient और outpatient दोनों के लिए अलग अलग सिस्टम है. Now we will consider about the drug distribution system. See, this one is a drug distribution system that is divided in any hospital, that is divided to the inpatient and outpatient. मतलब inpatient के लिए अलग सिस्टम है, outpatient के लिए अलग है. Inpatient again that is divided individual patient prescription filling. That means directly we are giving prescription to the patient, and patient he will go to the pharmacy store or drug store, and this is known as the individual patient prescription filling. Then floor stock system. For inpatient there is a floor stock on every floor there will be the nursing station and we will distribute the product over here. Then the combination of individual and floor stock system, then unit dose dispensing and pharmacy coordinated automatic electronic dispensing. So this is the divide, we can say how we by this way we can divide the inpatient in different high parts. Then again the floor stock system that is also divided in a charge floor stock drugs, charge non-floor stock drugs and non-charge free floor stock drugs. Now this charge floor stock drugs, it requires the labeling the floor stock drugs with easily removable labels. Then in case of charge non-floor stock drugs, there are two systems. One of that is the charge plate system and another one that is the envelope system. See, these are the system to distribute the drug directly to the inpatient. Then non-charge, in case of non-charge free floor stock drugs, there is a drug basket method to distribute the drug. Then mobile dispensing unit and mechanical dispensing unit to distribute the drug directly to the patient. Now we will see this one by one. First one, individual prescription order system. Over here the physician, he will write the prescription for the individual patient who obtains the drug prescribed from any medical store or hospital dispensary by paying own charges. मतलब यहाँ पे पेशेंट को डायरेक्टली एक प्रिस्क्रिप्शन मिलेगा, वो प्रिस्क्रिप्शन ही कैन सबमिट और ही कैन डायरेक्टली गो टू एनी मेडिकल स्टोर, डायरेक्टली ही कैन सबमिट टू द मेडिकल स्टोर. सो बाय दैट प्रिस्क्रिप्शन ही विल हैव देयर ओन ड्रग्स एंड यहाँ पे डायरेक्टली पेशेंट को चार्ज मतलब पेशेंट को पे करना होगा. पेशेंट ही विल पे फॉर देयर ओन ड्रग्स. दिस सिस्टम इज जनरली यूज्ड by the small and or private hospital because of the reduced manpower requirement. See, especially small hospital or private hospital, they are using individual prescription order system क्योंकि यहाँ पे कम से कम मैन पावर अगर रखना हो कोई हॉस्पिटल को तो यहाँ पे डायरेक्टली they have to use the individual prescription. यहाँ पे if you are giving the individual prescription, if you are using individual prescription order system, then less number of staff that is required in a hospital. So that's why small hospital and also in case of private hospital, the system that is the drug distribution system, that is individual prescription order system. So here there are some advantage of the individual prescription order system. All medication orders are directly reviewed by the pharmacist. That means pharmacist directly he will come in contact with the patient. It provides the interaction of pharmacist, doctor, nurse and the patient. मतलब यहाँ पे directly there will be the interaction in between pharmacist to doctor or pharmacist to nurse and pharmacist to patient. क्योंकि directly यहाँ पे patient है वो directly pharmacist को मिलेगा तो pharmacist he can review the prescription and accordingly if there is any changes, if the change is required मतलब कुछ change करने की जरूरत है तो he can consult directly to the doctor and it provides clear control of inventory. देखिए यहाँ पे डायरेक्टली फार्मासिस्ट का जो ड्रग स्टोर है तो यहाँ पे इसके ऊपर से डायरेक्टली कंट्रोल इन्वेंटरी कंट्रोल फार्मासिस्ट कर सकते हैं मतलब किस चीज की या कौन सी प्रोडक्ट की ज्यादा जरूरत है. सो लाइकवाइज इट विल बी कम टू नो बाय द फार्मासिस्ट. तो इट प्रोवाइड्स द क्लियर कंट्रोल ऑफ इन्वेंटरी. देन डिसएडवांटेजेस, there may be possible delay in obtaining the required medicine. कई बार ऐसा होता है कि पेशेंट को मेडिसिन प्रिस्क्राइब कर दिया है लेकिन he will make some delay to obtain it and the high cost to the patient. देखिए यहाँ पे directly the patient he has to go to the drug store, so that's why there might be the highest cost to the patient. मतलब ज्यादा खर्च हो सकता है या फिर ज्यादा कॉस्ट हो सकती है ड्रग की if he will go directly to the drugstore. So this is about the individual prescription order system. These are the advantage and disadvantage of the individual prescription system. Then next one, that is the complete floor stock system. See, the drug that are given to the patient through the nursing station. देखिए यहाँ पे एक और रोल दूसरा एक रोल आता है that is of the nursing station to distribute the product. and the pharmacy supplies from the drugstore of a hospital. That means we are supplying the product from drugstore to the patient by the use of nursing station. मतलब यहाँ पे एक nursing station का role आएगा to distribute the drug. Drugs are administered by the nurse according to the chart order of the physician. मतलब physician जैसा बोलेंगे उसके मुताबिक यहाँ पे nurse है, they will administer drug directly to the patient. So it is the now responsibility of the hospital pharmacist. मतलब यहाँ पे hospital pharmacist को क्या करना पड़ेगा कि they have to give proper drug to the nursing station, और मतलब nursing station में वहां तक उनको जो भी important means product जो भी prescribe की गई है, that is by the physician or doctor, that has to be supplied in the nursing station. So यहाँ पे again there will be one of the role of the hospital pharmacist also. Although this system is not used commonly in a government or other hospital where the charges are not taken from the patient. अगर यहाँ पे पेशेंट के पास से कोई चार्जेस नहीं लिए जाते या फिर गवर्नमेंट हॉस्पिटल है, then they are not following such type of system. So the thing, if we need to consider about the complete floor stock system, तो यहाँ पे जो भी required drug है, that should be given, that should be provided to the nursing station by the hospital pharmacist, and the drug that will be administered by the nursing staff to the patient. So advantage, easy and fast availability of the required drugs. देखिए कोई पेशेंट को अगर सीधा फिजिशियन ने बोला है कि ये ड्रग सीधा इनको दे दीजिए, तो इनिशियली it will, the product that will be available in the nursing station only. So directly in the ward there will be the nursing station, so directly they can give to the patient. So fast and easy availability of the product, elimination of the return of drug to the store or pharmacy, reduction in number of drug transcription for the pharmacy. मतलब यहाँ पे क्या है कि जो भी रिटर्न करना है या फिर ड्रग ट्रांसक्रिप्शन या फिर प्रिस्क्रिप्शन है वो कम हो जाएंगे. देन रिडक्शन इन नंबर ऑफ फार्मेसी पर्सनल रिक्वायर्ड, मतलब स्टाफ भी यहाँ पे फार्मेसी स्टोर जो है, ड्रग स्टोर है, उसमें कम से कम स्टाफ लगेंगे, मतलब ज्यादा स्टाफ की जरूरत नहीं है. So these are the advantage of complete floor stock system. Now the disadvantage of complete floor stock system, there might be the chances of medication error. That means medication error may increase because the review of the medication order is eliminated. देखिए यहाँ पे फार्मासिस्ट है, वो जो भी मेडिकेशन दिया जा रहा है, that is given by the nursing staff, so that will not be reviewed by the pharmacist, क्योंकि यहाँ पे फार्मासिस्ट का कोई रोल नहीं है. तो यहाँ पे क्या होगा कि such a product, so there might be the chances of, we can say, that is the medication error. Then greater chances for the pilferage. देखिए यहाँ पे थेफ्ट या फिर pilferage के चांसेस भी ज्यादा है, क्योंकि प्रोडक्ट है वो that is available in the drug store. Then increased drug inventory in the wards. देखिए वार्ड में ज्यादा सामान रखना पड़ेगा, या फिर हम कह सकते हैं कि यहाँ पे drugs that should be available in the wards. That means the maintenance of the wards that will be raised. Increased hazard associated with drug deterioration. देखिए कई बार ऐसा होता है कि ड्रग डिटेरियोरेट हो रहा है, so in this condition this will be known by the pharmacist, but this will be difficult to maintain by the nursing staff. So in such a condition there might be the chances of increase the hazardous product in a wards or in a nursing station, so this need to be considered. Then lack of proper storage facilities in the ward, on the wards, मतलब स्टोरेज फैसिलिटीज है, जितनी स्टोरेज फैसिलिटीज है वो अवेलेबल है हॉस्पिटल फार्मेसी में, इतनी स्टोरेज फैसिलिटीज यहाँ पे अवेलेबल नहीं रहेगी. सो देयर इज नो प्रॉपर स्टोरेज फैसिलिटी दैट विल बी अवेलेबल टू द आवर प्रोडक्ट. देन ग्रेटर लोड अपॉन द नर्स टाइम. देखिए नर्सिंग के ऊपर जिम्मेदारी ज्यादा आ जाएगी, मतलब नर्स टाइम का जो टोटल टाइम है दैट विल बी रेज्ड, एंड द लोड on a nursing staff that will be raised. So these are, we can say, these are the disadvantage of the complete floor stock system. Now, the complete floor stock system that will be again divided into charge floor stock drugs, charge non-floor stock drugs, non-charge floor stock drugs. मतलब यहाँ पे चार्ज हम ले रहे हैं उसके ऊपर से charge and non-charge that is divided. So first we will see about the charge floor stock drugs. See, charge floor stock, that means the medicine which are stocked on the nursing station at all times and are charged to the patient's account after they have been administered to them. मतलब यहाँ पे जो भी नर्सिंग स्टेशन में हमने जो भी प्रोडक्ट रखी है that will be when it will be administered to the patient, then afterwards it will be charged and that will be accumulated into the patient's account. मतलब directly it will be reflected into the patient's account when he will be discharged. तो यहाँ पे जो भी प्रोडक्ट हम नर्सिंग स्टेशन में से पेशेंट को देते हैं that should be charged. So that's why it is known as a charge floor stock drugs. Floor stock यहाँ पे नाम इसलिए है कि this product will be kept in a nursing station. That means in a floor, अगर कोई हॉस्पिटल है उसमें 3 से 4 फ्लोर है तो हर एक फ्लोर पे एक नर्सिंग स्टेशन रहेगा, हर एक फ्लोर पे डिफरेंट वार्ड्स रहेंगे और हर एक वार्ड्स के अंदर अगेन देयर विल बी द नर्सिंग स्टेशन एंड द ड्रग विल बी केप्ट ओवर हियर इन अ नर्सिंग स्टेशन. सो दैट्स व्हाई दिस इज नोन एज अ चार्ज फ्लोर स्टॉक ड्रग. नाउ द सिलेक्शन ऑफ ड्रग, देखिए कौन सी ड्रग हमें यहाँ पे फ्लोर स्टॉक में रखनी है या फिर कौन सी ड्रग नर्सिंग स्टेशन में रखनी है. The decision about this, it will be taken by Pharmacy and Therapeutic Committee, that is known as a PTC, and this will decide. They will consult again to the pharmacist, and again they will consult to the physician, surgeon, and specialist doctor, and accordingly they also consult to the nursing staff, and accordingly they will keep this all the product and they will prepare one of the list, and it will be kept in a नर्सिंग स्टेशन एंड दिस विल बी डिसाइडेड. दैट मींस कौन सी ड्रग हमें यहाँ पे रखनी है दैट विल बी डिसाइडेड बाय फार्मेसी एंड थेराप्यूटिक कमिटी, दैट मींस पीटीसी. देन वंस द लिस्ट ऑफ ड्रग दैट इज डिसाइडेड, नाउ इट बिकम्स द रिस्पांसिबिलिटी ऑफ द हॉस्पिटल फार्मासिस्ट टू मेक इट अवेलेबल टू द नर्सिंग स्टेशन. मतलब जो भी सिलेक्टेड ड्रग दी गई है दैट इज गिवन बाय द पीटीसी and that should be available and that should be reached to the nursing station, and the responsibility of this that will be on a hospital pharmacist. Hospital pharmacist, he will look after this. Now the hospital pharmacist, he will also see periodically is there any need of changes in this list of drug, that means what was selected by the PTC. Is there any need of addition of drug or deletion of the any product, मतलब कोई ड्रग को हमें ऐड करनी है, कोई ड्रग को रिमूव करनी है, अल्टरेशन करनी है, and this all the things that should be decided by the hospital pharmacist, or they have to inform to the PTC. They have to inform to the PTC that this drug should be changed. So accordingly the decision will be taken by the PTC. So यहाँ पे क्या है कि the only important criteria in selection of this product, that is the patient clinical need. देखिए पेशेंट को क्या चाहिए, कौन सी चीज की ज्यादा जरूरत है, that is most important to select the product that we want to keep in a nursing station. See, while the patient's financial status or the ability to pay should have no bearing on his clinical needs. मतलब अगर वो पेशेंट है वो उसकी फाइनेंशियल कंडीशन क्या है, that should not be considered when we are selecting such type of product. So the patient's clinical needs, that is highly important over here, and this should be supplied by the hospital pharmacist. Now this one is the list charge floor stock drugs for the common use in a hospital. Generally देखिए ये हॉस्पिटल टू हॉस्पिटल इट माइट बी वेरी, and this is again decided by the PTC committee, and accordingly general list we can say that is like this anti-allergic will be there, antibiotic will be there, in antibiotic penicillin, anticoagulant, that means heparin will be there, anti-epileptic, anti-hypertensive product, anti-emetic, anti-arrhythmics, vasoconstrictor, coagulant, diuretic, spasmogenics, tranquilizer, and some miscellaneous product, that means some potassium chloride, dextrose, mannitol injection, like that. Such kind of product that should be available in a nursing station. So this is general list of the drug, and that should be maintained in a nursing station, and this might be vary hospital to hospital. Then next, about the label for charge floor stock drugs. देखिए labeling here, that is also important. See, none of the world stock drugs, they are labeled with the direction for use. Here, when we are pasting any label, so never the direction for use that is mentioned on a label. This is because the fact that there might be some changes. Sometimes the dosage scheme that might be changed, therapeutic regimen that might be changed, and this change might be done by the doctors. So in such a condition, the label, it should not have any direction for use. So what it contains now? Label, it shows the name, number of the wards, and name of the patient, and the name and strength of the preparation, as well as any other relevant information regarding the label. So this is one of the example here: the wards, patient name, then the product, phenobarbital tablet, then the strength that is given 50 mg, then this is the trade name for this product, and this is the name of the hospital. So this is the very common label for a charge floor stock drugs, and this should be maintained when we are giving to the patient. Then charge non-floor stock drugs. See, the non-floor, when we are considering, so over here we are using one of the removable labels, small removable labels that is used, and which bears the name of the drug to the charge floor stock drugs. And this is, we can say, one common method of handling the charge floor stock drugs. यहाँ पे this is removable label that will be used in a non-floor stock drug to maintain the non-floor stock drugs, but this will be charged. That means the charge will be paid by the patient. And this technique that is used for the charging purpose and for the replacement of the drug on the nursing unit. देखिए कई बार अगर replacement करना होता है तो this will be good method if you want to replace the product. Then mainly in charge non-floor stock drug, there will be the two method. One of that is the charge plate system, and another one that is the envelope system. So first we will see the charge plate system. Here there will be a plastic or metallic card that will be available, that will be prepared on admission of the patient to hospital for patient's identification. मतलब patient अगर कोई hospital में enter होता है for an inpatient, we are considering about the inpatient, then a plastic or metallic card for the patient, it will be prepared, and that will be for a patient's identification. Now the card or patient identification plate that contains the information regarding the identity of the patient. मतलब जो भी कार्ड या फिर जो भी मेटालिक कार्ड हमने बनाया है, so उसके ऊपर से पेशेंट की आइडेंटिफिकेशन है, that will be come to know. Then the drug forms that will be prepared, one of the drug forms pre-printed in a triplicate, and on the basis of these drug forms, the product will be procured from the hospital for the patient, and these drug forms should have the information about the patient identification, or in such a case we can use the plastic or metallic card. So the separate drug forms that will be prepared, that will be the special preparation, and this will be sent to the pharmacist. Now pharmacist according to these drug forms, he will fill the prescription and he will supply the product to the nursing unit, and the nurse then apply the drug to the patient and make an entry on the drug form through the use of charge plate. That means now this product has been delivered to the patient, and civil or the nursing staff, they will enter such a forms. They will do the form of entry accordingly about the charge plate system. That means this will be noted into the account of the patient, and this will be these drug forms that will be available in a triplicate. So one copy that will be given to the pharmacy, that means it will be with the hospital pharmacist. Then another one copy that will be that will goes to the account, and third copy that will remain as it is with the nursing unit. So this one is a charge plate system. Here one of the example, that is for the charge non-floor stock requisition form. This is one of the requisition form. That means we can say this is a drug forms. This is for a Bharat Drugs Pharmacy. This indicates the patient name and number, and the same number that will be written in a charge plate system. That means the same thing, same number that will be on a plate. So that means we will come to know on the basis of number we can identify the patient, as well as on which area and on which floor the patient is kept. That means in which ward the patient is there, patient is hospitalized. So this will be understood by the charge plate system. Then again, indoor, outdoor patient, like that also we can see, mention in this form. Then the cost, unit and the charge accordingly, the total cost, total unit and total charge will be mentioned in this charge non-floor stock requisition form. Then the combination of requisition for medication. Okay, directly for medication. Then again the name and number will come over here, room number, then prescribed by which doctor, that will be indoor or outdoor, order by which doctor, order made by which doctor, and filled by which doctor, filled by which person. We can write the name of the pharmacist over here. Then in this case there will be the number, the drug name, dose, and the use of this, how often we are using this, the route of administration that will be mentioned over here. This is very important. In previous drug form the route that was not mentioned, but here the route is mentioned in this case, and also the quantity issued, cost and charge, and there will be the requisition number and the signature of the staff. So this is about the charge plate system, and by the use of this directly this will be entered, or this will be entered into the name of the patient. And now in this system there is no need to identify or no need to give name also. On the basis of number of plate we can identify the patient. The next one, that is the envelope system. Here the pharmacist fill the pre-labeled envelope with the specific quantities. मतलब यहाँ पे सीधा एक envelope fill करना है, उसमें specific quantity लिखी हुई रहती है regarding the specific drugs, and give them to the nursing unit. That means pharmacist पहले से ये form fill up करके, envelope fill up करके, और directly they will give to the nursing staff. When the drug is used or when there is a need of drug, the nurse places the identity of the patient. मतलब जो भी envelope है उसके ऊपर identity will be marked, identity of the patient it will be marked, and send it back to the pharmacy through its out basket where it is priced and forwarded to the account office. मतलब एक बार ये envelope use हो गया है, now ये patient को drug दे दी गई है, तो इसके बाद nursing staff है, they will mention about the identity of the patient on an envelope. Now this envelope it will go to the pharmacy store, and this pharmacy store they will mention this, and they will write down the price, how many drugs have been used and what was the price of that product, and then it will go to the account office, and accordingly this will be charged into the directly the account of the patient. So this is about the envelope system. Then non-charge floor stock drugs. Here it represents that group of medicine which are placed at the nursing station for the use of patient in unit ward, and for which there may be no direct charge to the patient account. मतलब यहाँ पे direct charge नहीं है. देखिए direct charge नहीं है मतलब यहाँ पे एक्स्ट्रा कभी पर डे के हिसाब से यहाँ पे डायरेक्टली इट विल बी मेंशन इन द पेशेंट्स अकाउंट. See, in fact, the cost of the group of drug is usually calculated in the per day cost of the hospital room or ward, and accordingly this will be charged to the patient account. But directly we are not mentioning any charge to the patient. देखिए यहाँ पे अगर गवर्नमेंट हॉस्पिटल है तो उनके रूल अलग है, प्राइवेट हॉस्पिटल है तो दिस विल बी मेंशन एट द एंड व्हेन द पेशेंट विल बी डिस्चार्ज. Then in this non-charge floor stock drugs, again we can see the common product we can say that is a commonly stored free floor stock drug that includes, देखिए this is non-charge free floor stock drug, so this will not be charged. For example, which product will not be charged? For example, preparation like normal saline solution, dextrose injection, absorbent cotton, gauze, then antipyretic, for example paracetamol, antihistaminics, diphenhydramine, antiseptic, disinfectant, for example Dettol or Sevron. This will not be directly charged to the patient accounts. So these are the common product which will be kept in the nursing station. Rarely used or particularly expensive drugs that are omitted from the floor stock. मतलब rarely used जो भी हो रही है product या फिर costly product है, so that will be omitted, that will be removed from such a list. This system is used mostly in government and other hospital in which drug charges are not made to the patient directly. देखिए ये government और कुछ trust run जो भी ट्रस्ट की हॉस्पिटल है वहां पे भी ऐसा हो सकता है कि that will not be directly included. For example, if the Dettol has been used, disinfectant has been used to the for the treatment of any patient, then this will not directly charge or it will not be charged in the bill of any patient when he will discharge from the hospital. So this is about non-charge floor stock drugs. The method that is used for the distribution of non-charge floor stock, that is the drug basket method. Here there will be the medicine cabinet or the nurse who are doing duty in a nursing station. They will check the medicine cabinet and also they will check the utility room and drug refrigerator inventory. They will prepare one of the list that which product that is not present in a nursing station. Accordingly, there will be on the basis of basket method. See, this one is a drug basket. So on the basis of drug basket, there one of the list will be attached and one of the list will be provided by the hospital pharmacist to the nursing staff. So nursing staff now they will check their nursing station and on the basis of that they will prepare one of the list. And here if the product is not present, for example this bottle is not present, then this will be in an empty mode. That means on the basis of this, or over here there are these are the some places to store the strips. So on the basis of this, the nursing staff they will come to know that there is no product over here, now there is no stock in a nursing station. So they will mention, they will prepare one of the list. Now this list that will be forwarded to the hospital pharmacist, and now hospital pharmacist again they will prepare accordingly and they will fill this all the product. For example here the container that is empty, then the pharmacist they will fill this product and they will send back to the nursing ward or nursing station. That means this is very easy communication. We can say the nursing staff they have to only see that which are the empty container, then when it will go to the pharmacist, then pharmacist have to directly they can see which are the empty container or which are the empty places, and accordingly they will place the product and directly it will go to the nursing station. So one of the method we can use for a non-charge flow stock drug, that is the drug basket method. Then mobile dispensing unit. Here the two stainless steel trolley with suitable wheels, steering handles and locking sliding doors and shelves that will be available. Two trolley that will be available in this mobile dispensing unit, and one will be kept in a nursing station and another one when it is required to fill, then it will go to the pharmacy store or to the drug store. This trolley they will have specific dimension, for example 60 inch high, 48 inch wide and 25 inch deep. to fit all type of container. That means all type of container will be fit over here. For example, this one is an example. This one is a handle of the trolley, then tray for capsule and tablet jars, then instrument tray. This one is a dressing material. Over here there is a stock mixture, that means the bottles, and bowl of disinfectant solution. So easily this will be identified by the pharmacist which things are not present over here, and that will be filled by the hospital pharmacist and sent back to the nursing wards. So advantage we can say, it save the time of the nurses. यहाँ पे टाइम बच जाएगा, नर्स को ये कुछ देखना ही नहीं है, डायरेक्टली इट विल सेंड टू द हॉस्पिटल फार्मासिस्ट. देन इट मेक्स फार्मासिस्ट अवेलेबल फॉर कंसल्टेशन टू नर्स, फिजिशियन एंड पेशेंट. देखिए यहाँ पे फार्मासिस्ट he will come directly to the nursing ward or to the nursing station. So pharmacist can communicate directly to the nurses. Also he can communicate to doctors and patient. So this will be there will be the easy communication of pharmacist to the nurse, doctor and patient. The ward drug cabinet is supervised daily by the pharmacist so that damaged, expired and non-approved drug may be quickly removed. देखिए यहाँ पे directly the observation will be done by the pharmacist. So pharmacist he come to know if there is any damage or any expired product is there, then directly he can remove such a product. So यहाँ पे क्या होगा कि nursing staff की responsibility कम हो जाएगी. The responsibility that will be of the pharmacist, and nurses का time है वो यहाँ पे कम बच जाएगा, या फिर उनको ज्यादा problem नहीं होगा if we are using such type of mobile dispensing unit. Then mechanical dispensing unit. This is designed to dispense a maximum of 8 package of 96 different items. The pharmacist they will place the suitable medicine into the cardboard box made according to the size of the unit. They will prepare a pre-packaging control sheet and finally they loads the package into the machine. मतलब यहाँ पे machine में directly pharmacist है, they will load such a product and the box whatever the box or they are loading in this instrument, that will be of the same size, so that directly it will be fit into the dispensing unit. And now this will go to the nursing staff. That means this instrument that will be with the nursing staff. Now the nurse they have to insert 3 blades to activate this instrument. That is the patient identification they have to enter, then medicine identification they have to enter, and the third thing we can say that is the nurse identification. And on the basis of this they will have the product, the machine when it will be activated, they will dispense the package of medicament, and the instrument it will print a label, and the charge ticket it will be created and it will be recorded in the patient. It will directly recorded into the account of the patient. So very easy system, and we can say the advantage. This system it will control the number of drugs stored in a nursing section. It will reduces the pharmacy and nursing inventory. देखिए directly यहाँ पे क्या है कि हमने जो भी product है that has been stored directly in this dispensing unit. So inventory control that will be reduced. The management of inventory that will be reduced in a nursing ward and also in a pharmacy or in a hospital pharmacy. So this is about the non-charge floor stock drugs. So over here in this video, as a summary, we discuss about the dispensing of drug to inpatient. Then in inpatient we discuss about the individual prescription order system. Then complete floor stock system. Then in complete floor stock system there is a charge floor stock drugs in which the labeling that is required. Then afterwards we discuss the charge non-floor stock drugs. There are 2 methods for a charge non-floor stock drugs. One of that is the charge blade system, and another one that is the envelope system. Then the non-charge floor stock drugs, in that we discuss about the drug basket method, mobile dispensing unit and mechanical dispensing unit. In next lecture we will discuss the remaining method for the drug distribution of inpatient, that is the combination of individual and floor stock system. and unit dose dispensing and pharmacy coordinated system. So we will discuss this point in a next, and also we need to discuss in this chapter, that is the drug distribution for a outpatient. Thank you for watching this video.